to turn the call over to Elisa Aris-Pacachaga. Please go ahead.
Thank you so much, Todd. Really appreciate it. And welcome and good afternoon. Today's session is entitled Partnering to Strengthen the Healthcare Workforce. And this really is truly about partnership. I am really excited to have this wonderful group joining me today. This grew out of a partnership between the AHA and the National Association of Workforce Boards. Make sure I got that right. And we've really been talking about how our two organizations and our members of our organizations have been working together from the local workforce boards and the hospitals in their communities to really understand how they're enhancing educational pathways and creating healthcare career programs and really deepening those connections to the community that can really continue to fuel strength within our communities and help train our healthcare workforce of the future. I probably don't need to tell anyone who's listening in about some of the challenges we face in building the healthcare workforce and how it's been strained during the pandemic. But I'm really excited to talk through with the leaders on this call about the various partnerships and the opportunities they've created within their communities and the ways that they've really rethought how to grow their own communities and really foster ongoing career growth, diversity, inclusion in hiring, and really building a strong workforce. So with that, let me turn it over to my colleague at the National Association of Workforce Boards. Melanie Anderson is their Executive Vice President. So just want to ask Melanie to also share her welcome.
Thank you, Alyssa. I just really want to quickly thank the American Hospital Association for putting this webinar together. We know this is, especially right now, a really critical topic to see how workforce boards are collaborating with the healthcare workforce in their communities. I especially want to thank Employ Milwaukee and Charlotte Works for always answering the call when we reach out. They're doing amazing work in their communities, and they're always willing to step up and share, their lessons and what they're doing to the broader workforce community. So thank you both for joining this. And Alyssa, a special thank you to you and your team for continuing to partner and have conversations with us. We are excited about where this partnership can go and excited of sort of this first step in having I'm really expecting a robust dialogue. So thank you.
Thank you. And thank you to Alberto, who was the first to reach out and help us put this together. So without further ado, let me introduce our speakers. From Charlotte, North Carolina, we have Cynthia Bailey, who is the HR Manager of Workforce Strategy at Atrium Health, who is closely partnered with the Chief Programs Officer at Charlotte Works, Shemia Williams. And then from Milwaukee, Wisconsin, we've got Chytania Brown, who is the President and CEO of Employ Milwaukee, who is working closely with Michele Smith, the Director of Workforce and Team Member Development from Advocate Aurora. So it was really nice to be able to put together a panel of 2 AHA members along with 2 members of NAWB to really talk through how they're working together. So I'm going to be asking some questions, but as Todd mentioned in the opening, please do feel free to type in your questions in the chat on the right side of your screen, and we will have time for your questions at the end. But let me start with you, Chytania, talking a little bit about some of the programming you've created to really grow those healthcare workforce opportunities within your community. And then Michele, I'll ask you to add your thoughts on it.
Yeah, well, thank you, Alyssa. We actually, just taking it back a little bit, when you look at labor market information here in Milwaukee County, you see overwhelmingly healthcare positions continue to be in the top 3 when we look at the availability. Also, it's part of our high growth, high demand jobs when you look at that availability and opportunity as well. A few years back, we came together with 4 of our major hospital systems and put together the Center for Healthcare Careers, which brought together intentional efforts to bring together entities who would oftentimes be in competition with one another, but understanding the demand and the need it was better to see how can we come together and collaborate and be able to meet all of our needs by creating some worker training opportunities to help build those talent pipelines to fill those needs. And so that's how we kind of got really into close industry employer-led efforts. And industry partnerships is something that we love because we know that when the employer is at the table, part of the discussion, part of the planning, we know that when individuals complete, there's employment opportunities at the end. There's almost, you successfully complete, there's almost guaranteed employment at that point for individuals coming through. And so with that partnership, our medical college offers community grants, and we apply for a grant to do some medical assistance training as one of the initiatives of the Center for Healthcare Careers, a collaborative. So that was kind of our first out of the box. It's an accelerated medical assistance training program looking to supply the needs of the 4 hospitals that are part of it. But then we've done quite a bit of work with Advocate Aurora because with there we have another partnership that we have a grant, and I'll let Michele talk a little bit more about that particular piece. But we just found that when we're working together and you create these industry partnerships, they become easy. They become ways to really help build that talent pipeline and be creative and innovative from our traditional modes of how we look to hire folks. And then that intentionality of tapping into communities where oftentimes traditionally those are not the ones coming into these jobs, and really looking to help diversify the talent pipeline and creating opportunities from growth within. So, Michele, I'll turn it over to you to fill in the pieces to talk about the programming with Advocate Aurora.
Thank you, Chytania. So yes, as she said, our relationship, we have several programs that we partner with Employ Milwaukee and other community-based organizations in the Milwaukee area on, and it is a very fruitful relationship that we have with Chytania's organization. And so just to talk a little bit about the success of that medical assistant program, that accelerated program, and so over the course of the time that we've partnered with them, we've had 36 individuals go through the program. 32 have successfully completed. All 32 have been placed. So we have a 100% placement rate for the individuals that completed the program. Our retention is about 85-90%. Our retention is 100%, and then our completion is about 85 to 90%. And so we are continuing that program. It is serving our need for medical assistants. Across the system, we probably have about 300 medical assistant openings currently, and so that partnership is just an example of how Employ Milwaukee is helping us to address our talent needs. And then to transition a little bit to the grant that Chytania talked about, in addition to that medical assistant pathway, we have a Milwaukee Healthcare Workforce Initiative. And so that is really a healthcare collaborative between Advocate Aurora Health and several community-based organizations, as well as Milwaukee Area Technical College. And so the intention behind that program is to, again, help to identify entry-level and middle-skilled healthcare occupations that are in high demand, and then align individuals in the community that are either unemployed, underemployed, or low to moderate income residents of Milwaukee, enable them and arm them with the skills necessary to transition into a career in healthcare. And so at the culmination of that program, they are guaranteed an interview. We do have opportunities for them to do some shadowing and experience, what it would be like to work at Advocate Aurora Health prior to them completing the program. And so that program will continue for another couple of years, and so we're very excited that we have the opportunity to have strong partnerships with our community-based organization and workforce boards in the workforce board in the Milwaukee area to make sure that community members and those that we serve within the community don't look at Advocate Aurora Health just as a healthcare system, where they come to have their healthcare needs served, but also as an employer, and that we offer a plethora of opportunities for them to be able to find a career pathway.
I love that. It really is, those sounds like some great programs. Shemia, let me turn to you to talk a little bit about some of the work that you've put together. Again, really some of the programming that you've been able to create locally, and then I will ask Cynthia to chime in from the health system perspective.
Absolutely. Thank you so much. In 2016, Charlotte, we were identified as one of 7 regions in the U.S. to work on what was called and has been called a Health Career Pathways. And it's a national initiative. It was launched by the White House in an effort to strengthen healthcare workforce. Atrium Health, which is one of the leading healthcare organizations in the Southeast, they were chosen as the lead employer. And Charlotte Works, we were chosen as the Workforce Development Board for Mecklenburg County and Charlotte. We were chosen as the backbone organization for this initiative. Additionally, Workforce Development Community Partners were invited to join this initiative. So when I say that, think about a Goodwill or Dress for Success or Department of Social Services, our school system, etc. There were other regions that were attached to that, Minnesota, Michigan, California, New York, etc. But through this initiative and this partnership we've had with Atrium Health, we're able to identify talent to fill very specific roles. So CNA, CMA, and RN. And the goal of that is, one, to do that, but also to educate job seekers on these in-demand jobs and support them in their career paths. So in order to fill these roles, our Career Center team, along with over 20 community partners, are able to vet and refer qualified candidates for consideration of hire for those roles. Mind you, individuals can be considered whether they have completed training or if they're currently in training. And the great, phenomenal thing about this partnership is these individuals do not fall through a black hole, or through the ATS system where they normally would not have been considered. Atrium prioritizes consideration of these candidates, and they have an internal process where their recruiters and hiring managers are aware of the initiative, and they prioritize the referred candidates for these roles. And just to be clear, individuals are able to apply for the positions they're interested in, but Atrium also identifies opportunities that they deem candidates are qualified for as well and submit them for consideration. And overall, I say from my perspective, and I will definitely hand it over to Cynthia, the value add of this initiative is the fact that we're able to align and strengthen partnerships within our workforce system. When you think about educators, employers, community partners, by promoting these healthcare career pathways and economic mobility. But I've shared a lot of information, so I would definitely hand it over to Cynthia to share more.
Thank you, Shemia, and everything that she said, plus, the outreach to the candidates, I think, is really crucial. We meet with our Workforce Development Board weekly about our candidate movement and progression. Every week, they are sent a listing. There's a specific list. We query out the specific positions, the medical aides, the nurse aides, and the even nurse positions, if anyone's qualified for those. And so we're constantly sending them postings. As you know, postings change from day to day. And so we want to keep things fresh for the candidates. We're following up with them. Did they apply? If we see that someone hasn't applied for something in a week or so, we are out doing some outreach, working with their career advisor, just to make sure they're constantly in the pipeline and being considered for some of our roles. I really do think that's the beauty of our partnership, is that there's just this constant communication back and forth with the candidates, with the Workforce Development Board, even with the hiring leaders. So as Shemia mentioned, they are prioritized. It's almost guaranteed that they will get an interview. And as you can imagine, some candidates are successful and some are not. And when they're not successful, we seek feedback from our hiring leaders to ask, what was it about this candidate that made them be dispositioned for the role? And that feedback just helps the candidate for the next round when they are positioned to interview again. So it's a constant partnership, constant communication with both the candidate and the Workforce Development Board that I think is really the secret sauce to the success of the program.
I love that idea, Cynthia, that this isn't just about making sure that we're filling these roles, but we really want to make sure that we're helping these candidates succeed and find the right role for them. That really makes a huge difference. So let me start with you on this one, Michele. How did you, even, well, honestly, even find Chytania's number in the phone book, or really develop that connection? And within your own organization, as leader and advocate Aurora, say, okay, well, this is the value proposition for us. This is what it brings to us. And specifically, I really want to get at how are you using some of this programming to do something that I think is essential to providing good healthcare, which is to grow the diversity of your workforce. Let me turn it over to you.
Thank you. So, honestly, how did we develop the connection? Chytania and her organization are strongly entrenched into the community, and so it just makes sense for our organization. We want to make certain that we are serving the communities that are in our geographical area in a number of different ways. And so, obviously, as with many healthcare organizations, we have a large number of talent needs. And so it just makes sense, strategically for us to partner with an organization such as Employ Milwaukee, and obviously having those connection points with the Workforce Board and the work that they do to ensure that, community members have the skills that they need and understand high growth and high demand careers, and aligning them with opportunities and employers. And so I have to say, I am very proud to work for Advocate Aurora Health, because we are so engaged and focused on ensuring that we provide opportunities for individuals to find a career in healthcare. And so how do we use our programming essentially to grow our diversity within the healthcare workforce is, again, just ensuring that we have strong relationships with our community-based organizations. And so we want to ensure that our team members reflect the communities that we serve. So oftentimes when individuals come into our healthcare systems, it's not their best day. Sometimes they leave having heard difficult information. And so it's important for us to make sure that the staff that they encounter from, the beginning of their visit to the end are a reflection of the community, and that we are sensitive to the needs of everyone that we serve. And so it's really a no-brainer for us to have this relationship and this partnership. And again, I would also say that it helps us with our mission in terms of health equity, because in helping individuals find careers in healthcare, we are increasing their economic mobility and creating, impacts for them to have wealth building within their homes for generations to come, and they pass that on to their children, to their aunts, to their uncles, to their cousins, and it does change the impression that they have oftentimes of the healthcare system, because they often, they haven't always had the best encounters, or they've had, difficult encounters, and so they have a loved one that works for the health system, or a friend or a neighbor, and they can talk to them about Advocate Aurora Health and speak positively of their experience as a team member. I think it also opens the doors for community members to feel more comfortable when they do need to proactively take advantage of their health and not feel so constricted or concerned or scared about what that experience will be like. So I definitely think it has a holistic impact on the community, and continuing to have strong partnerships and building different programming, with Chytania's organization and others alike just enables us to serve the community in every way that we can.
Absolutely. It was extremely well said. Chytania, anything to add on the impact that you're able to have on both what the value proposition, obviously you talked a little bit about the value for the Workforce Board in really those partnerships, and I love your term, the employer-led efforts. But how are you using your program to really help the healthcare workforce really engage with the entire community?
And thank you for the question. So we have six sectors that we put emphasis on as a workforce development board, and being that we're the largest workforce board in the state of Wisconsin, servicing Milwaukee County, of course, healthcare is one of our sectors that we put emphasis on. We have an industry advisory board comprised of members of the healthcare community as well as smaller healthcare entities that are a part of that. So having a seat at the table, having an understanding of the healthcare industry needs, that helps us better position as people come to us, whether it's in youth development, individuals, adults who are looking for employment opportunities in the healthcare industries, being able to know what they're looking for so that we can customize and work with and steer them in a direction that we know those are the positions people are hiring for, getting them the credentials necessary to do that. And also, someone put in the chat, how do we career pathway people? That's also a part of the work that we're doing with our healthcare partners, is looking at, if you come in entry level, how do we pathway you through to other opportunities within? So that's the intentionality that I talk about in these partnerships. It's not just about getting people jobs. We do that all the time. But how do we, with intentionality in these industry-led partnerships, not only bring people in, but pathway them to other opportunities within those particular industries, in this case, healthcare. And so healthcare continues to be, like I say, sit in the top 3 when we talk about growth sectors or growth occupations here in Milwaukee. And so it's to our advantage to be at that table, to be part of those conversations, and to steer our resources to train up and skill up individuals to be able to fill those talent pipelines. And then being a workforce board, we bring that workforce training. We bring those dollars to the table to be able to be innovative and creative in this space to help individuals who want to take advantage of or be part of, the healthcare systems, and to educate them. Because that's another piece that when you think about people in communities where there's not a whole lot of introduction besides when they go to the doctor and they see the nurses and they see the doctors, but having an understanding of other occupations that go well beyond doctors and nurses that does not require that level of education, and being able to pipeline them into those opportunities or create opportunities to expose and introduce our young people as well as our transitioning adults into those opportunities.
Forgot to unmute myself. You'd think after 2 years of pandemic I'd remember how to mute and unmute. Apologies. Cynthia, let me ask you to talk a little bit about this, and then I see we've got a question here for Chytania. We can get to that one after. But yeah, talk a little bit about, again, the same question, sort of how do you view this and how you use it to grow diversity in the Atrium Health workforce. But I just want to put a little bit of a highlighter pen to that last point that you made about the fact that there is an entire city worth of jobs within most of our member organizations, within hospitals, and maybe tease out that point a little bit about how do you help people see where those jobs are?
Absolutely. So we have several different pathways. So health career pathways that we partner with Shemia and the Workforce Development Board with, that's one pathway. But we have programs also where we're working with high school students. It starts with the 10th grade program, our patch program. We work with high school seniors to really expose them to, if college might not be your next step for the seniors, maybe you can consider a pharmacy tech or some of these positions that just require a certificate into Atrium Health. We really try to talk to the kids early about some of those roles to create that pathway. We have an education partner where we are constantly working with them, because the education benefits partner, they have coaches that are also, hey, did you know Atrium Health has this internal surge tech program, or this PSA, patient sitter to CNA program. So we position our partners to talk about our pathways. We're also talking about them as a workforce strategy team. There's just several different ways to get that message across. We're lucky to have a lot of internal programs where we're trying to grow from within. So once they come through from Shemia and the Workforce Development Board into a CNA or CMA role, then we can really start to, there's constant communication about our education benefits, the different pathways, lots of leaders. I think the pandemic has helped us do these pathways quicker. We realize we need to have these positions ready, have a workforce on deck. We have this very lofty goal in the next couple of years that we're going to have 0 time to fill some of our vacancies. And so by having these entry-level folks and as they move up, and then again bringing high school kids or other teammates who have gone through their education pathways, they're positioned to go right into these positions.
Great, and I love that there's a conversation going on in the chat as well, and actually one of my questions is about that, fostering those pathways for career growth, so we'll get to that next. But Shemia, let me give you a chance to talk a little bit about this issue, about how you really bring value both to the board and the system, but then how you use this work to grow the diversity of the community, of the healthcare workforce.
Sure, thank you. When it comes to the connection and the value proposition that we've made, it pretty much happened through the need and the agreement to have a collective impact on our community, right, through this initiative. When Charlotte Works, when Atrium Health, and other community partners originally met to discuss the initiative, we collectively developed a process by which we would refer the candidates, including a resume, a career portfolio for each referred candidate, identifying their education level, their computer proficiency, their certifications, BLS, all of that, as well as creating a feedback loop of sending the referrals. So when we send referrals, the awesome thing about this, we're getting a feedback loop from Atrium to know what is going on. So that ensures consistent development of these candidates. Because as you all know, sometimes your candidates are referred, they're going to an employer, but let's say they interview and they don't interview well. Well, what happens next, right? So the value add is Atrium is able to say, hey, community partners, we interviewed, they need to work on their interviewing skills a little bit more. So that additional development has truly helped with the connection and the value proposition that we have with this whole initiative. But I also would say that the value proposition was the fact that along with the other community development partners and ourselves as the Workforce Development Board, we're providing, as these ladies have shared, the same thing, we're providing training scholarships, right? And so that's offered by local training providers, and it's for those particular roles, which of course increases the talent pool that we could refer to Atrium. And we're very intentional where it's not just your big wig, your common community partners that you know of, or when I mentioned Goodwill, love them dearly, but it is also tapping into grassroots organizations that are really boots on the ground, may not be as visible, but there's a higher need that we've got to tap into to create awareness of the opportunity, to create the awareness. There's training. I remember being a career advisor many years ago, and individuals coming and say, hey, I want to be a CNA, nothing wrong with it. However, did you realize the conversation has to be, and this is where we're intentional, it has to be, that is what you know. However, did you realize that if CNA is a requirement to become an RN, right? Did you know that there were other opportunities to be a CMA where you might have more opportunities available to you, where you potentially can make more money? And that's the thing that is needed right now, and it is sustainable living wages. People are struggling, and also the value add here is as they're connected, they're getting the training, they're getting supported services. Those supported services, we as a Workforce Development Board, we're able to help in certain areas with transportation, with books, etc. But we take it beyond that. Maybe it's connecting to community partners that can provide resources in the area of child care, in the area of housing. And that's another piece that Atrium is very intentional about as well, where it goes beyond, hey, we may initially bring them in and provide supportive services, but Atrium is doing the same, where when those individuals are hired, they're providing the child care resources, housing. It may not come directly through their funding, but they're connecting them to that resource, because that is a challenge, too, to keep people engaged, employed, and interested in training. So hopefully that answered your question. I know I went a long way around, but necessary.
No, but I think that gets to one of the sort of side conversations in the chat a little bit, and it was one of the questions I was going to ask. So let me start with Michele and then we can go around again. But this idea that not only is this the way that, you know, these partnerships are not just about getting people in the door. This is about how do you support people in their career growth? What are those pathways? How do you make those connections and really help people in partnership and even beyond really continue to grow? So Michele, I know you have a program, and I see Cynthia, you also have a program, so want to hear from both of you about this.
Yeah, absolutely. And so as you see, I typed in the chat Navigate program. And so that is specifically designed for frontline team members. So they have to have been in a role for at least 6 months, and they are typically, and they have to be in a non-leadership role. So we have team members from food service, CNA, our environmental services, and other tech positions that enroll in our Navigate program. And so it's a 5-month program. And so it's really to help team members understand and strengthen their skills and understand what they need to prepare themselves for future advancement within the organization. And so they have 10 sessions. And so we go over navigating stress with them. We have a session on emotional intelligence. We have a session on effective problem solving, diversity, equity, inclusion. And so we also do a strengths finder assessment with them to help them better understand who they are as a team member, both personally and professionally. And so the intention is really to give them the skill set to feel confident in being in the driver's seat of their career. And so many have not had the experience of working for an organization the size of Advocate Aurora Health, where we have so many opportunities for them to grow their professional life within our organization. And so from Navigate, we also have a variety of other upskilling programs. So we have a surge tech program, a sterile processing program. We have apprenticeships in culinary as well as facilities maintenance to really equip team members with the ability to see themselves build a career at Advocate Aurora Health and also build that skill set to become a future leader. And so that's why within that Navigate program, we're not just talking about, well, how do you send a professional email and how do you interview, how do you put your resume together, but we have courses that really are going to help them develop. And so that's why we focus on, the entire team member, and we have that emotional intelligence course. We have courses on navigating stress and managing up to equip them with the skill set to be successful and navigate every interaction, whether that be with a patient, with a supervisor, or with a colleague. So we do see success from our Navigate program. And then in addition to that, the other half of my team, we do have high potential programs as well. Our Emerging Leader program is similar, but that is aimed at individuals that are specifically looking to move into supervisory roles. So oftentimes we have team members go from Navigate, they stay in their role, or they may advance to a lateral position, and then they end up in our Emerging Leader program as a high potential because they're on the pathway to becoming a supervisor and continuing to grow their career at Advocate Aurora Health.
Great, thank you. And Cynthia, why don't you tell us a little bit about some of the work you're doing, and then I'll come back around.
Sure. We do have similar programs to what Michele had mentioned, and we also have a sterile processing program where we focus on our environmental services, our frontline staff. These are the staff that are cleaning the patient rooms, and we prepare them. There's a 16-week training program to prepare them for sterile processing roles. If they're successful in that program, we then promote or encourage them to apply to our surge tech. We have a surge tech apprenticeship program. So we are constantly working with our frontline folks to increase their awareness of growth opportunities. We have scholarships that are available to teammates who make under a certain amount of money. One of our scholarships is only for teammates who do not have a college degree, and they earn under a certain threshold at Atrium Health. It's called our Education That Works program. So really trying to upskill those teammates to get ready for the next level. We're also looking at our critical roles to ensure that their field of study is in alignment or is really geared towards those critical roles so that they should have no issue with going right into those positions once they graduate. some of the support that all of our workforce strategy participants get is a career coach. This is someone who is taking that holistic approach. They're not just checking on, are you meeting your career goals and what, what's the next step in your schooling, but, they've helped individuals get their citizenship papers together sometimes if individuals were having trouble with that. They make referrals to our EAP when there might be trauma that's happening, because it's very hard to focus on school and career when things are going on at home. And so that is what our career coaches do, and they stay with the participants throughout the program. There's individual. Every month there's at least 1 hour that they have to be in contact with that career coach. And then we also have group sessions where we bring all of the workforce strategy participants with the coaches, various topics on soft skills, networking, how do you show up to work, what's your brand, different things like that, that we're also having those professional development sessions with them as well.
That's wonderful. All right, let me turn back to Chytania to tell us a little bit about, so from the workforce board perspective, what are some of the, are there activities that you're partnering on to really foster some of these pathways? You mentioned a couple of them, of these longer term career growth pathways, but just anything else you want to add on that?
No, I think we've mentioned them, that the work that we've been doing are intentional partnerships that we've had. In the past, we've done things with our tech college where we've ran training programs, but the key to success in all of this is making sure you have the industry or the employers at the table, because in that particular instance, individuals have a good shot at getting the job versus training a lot of folks for occupations or particular programming, and then we're looking for the employers after the fact. Being able to come into these situations with the employer at the table from the onset, employers in our case, because we've had multiple, you create a better situation for individuals when they complete the training. You know that you're funding and putting people through those jobs or trainings that we know there are jobs in the back end for them. And when you're dealing with certain communities, you're also looking at the accessibility to these jobs. You'll see where there's folks who want to apply for certain types of jobs, but where they're not located in spaces where individuals have access to get to them if there's not transportation that goes there. And so in this particular case, you know where they are, you know where the jobs are, so when people are coming and they're signing up, they know specifically. Or you can address if there are transportation issues or child care issues. This allows us to do all of those things up front versus individuals going into training, finishing up, and still have potential barriers to employment, or they're looking for jobs and those jobs are not within their reach as far as their ability to get there. And so these are just an example of how we've been able to think differently about how we approach developing those talent pipelines and connecting people with the employment opportunities.
Great, thank you. Shemia, anything else to add on that? And then I see we've got a bunch of questions in the chat, so we'll go to those next.
Not a lot, but I would say, because Cynthia has shared a lot there, but I would say the mere fact that we love, and Cynthia talked about this, the fact that we stay in consistent communication about what's working, where there's some opportunities. And for us, it's a matter of the interest that we're seeing coming through the doors beyond the CNA and CNA to create an opportunity. It may be medical billing, medical coding, and so we have exploration conversations. Cynthia, I won't go anywhere where we haven't gone yet, but we're having those conversations about what it would look like to consider doing another pathway, or where the opportunity may present itself. Even when they begin to have things internally that they're doing, we have conversations to see what we can explore beyond that, as well as having some conversations. Cynthia probably will smile at me, but we've had an apprenticeship opportunity where we did on-the-job training, and we'd like to explore that more. So it's really just taking this best practice, sharing what's working and where there are opportunities to see what else we could do programmatically, but we've done pretty well with this so far.
Wonderful. And all right, this is a question that's probably likely to be for either Chytania or Shemia, but some of the budgetary considerations, and I know, Chytania, you specifically mentioned a couple of specific grants that you were working on, but either one of you want to comment on some of the grants and resources you use to sustain your programs?
We use our Title I funds, so our Workforce Innovation Opportunity Act funds. In our particular instance here in Milwaukee, our medical college has a number of community grants that we've applied for in partnership with the hospital systems to go after some of that funding, to do some of these partnerships. Right now, we have our American Rescue Act Plan funds that we've looked at diverting funding toward to continue to develop cohorts to run through these opportunities. And then there's also, whenever we see grant opportunities, as we're thinking about planning for, Shemia mentioned, like, you think about the next thing that we can actually do, or the next part of this you want to tackle. Our fund development teams are all constantly looking at the resources. And then I must say that our hospitals have committed, like with our Center for Healthcare Careers, our hospitals, they each make contribution to be able to support the staff who run our Center for Healthcare Careers. So there's financial commitment from the hospital groups as well to support many of these efforts, even to the extent of paid training for individuals who are in like the medical assistance programming. They're getting paid while participating in the program, and that's all coming from the employer.
Great.
And for us, and for us, it is the same as far as we owe a Title I funding as well, that is supporting the team members that are supporting this, even from the board side, as well as the Career Center. But very similar to what you just mentioned, we are pursuing ARPA funding as well, and looking for additional diversified funding so that we may continue these great efforts, specifically looking at also where it will tackle and touch more of the second chance justice involved individuals, as well as looking at work-based learning opportunities in the area of on-the-job training and upskill. And that would be a value add where potentially maybe Atrium, and not just Atrium, it's not just maybe they're not going down the on-the-job training road, but there may be an opportunity to upskill through some of our funding if needed, so that they could increase the career advancement, career pathway opportunities for those that they currently have in their system.
Great, thank you. And this one, I guess, there are two questions that sort of go together for both Michele and Cynthia from the organization side, and particularly the HR roles that you both play. I like the idea of best practices on how to move people through as efficiently and effectively as possible. I love the example that Cynthia and Shemia, you mentioned of that feedback loop so that you help improve people's skills. But so both that question and then the question that focuses on who's the best person to do this, and I'd love to know who you're partnering within your organization with. So Cynthia, why don't I just start with you, and then we'll pass to Michele.
Sure. I could not do this without the hiring leaders of the specific departments and my talent acquisition team. We have to be lockstep, and it took us a while to get that. We're working with the Workforce Development Board. We're sharing what the positions are, but it's the talent acquisition teams and our hiring leaders that are truly helping to get people in place. We have an online hiring process. Sometimes it can be cumbersome. There's thousands, hundreds of applicants, and so we want our applicants to rise to the top, or for leaders to be aware of who they are. And so we're often sharing the goals of some of our programs, especially those that are serving the underserved or underemployed, or we even have a program focused on certain zip codes that we had implemented. And so we have to have that partnership with our talent acquisition team. As most HR folks know, our postings change daily. Things go up, things come down on a regular basis. And so having that insight from our TA teams, speaking to our hiring leaders, maybe they don't have anything today, but gosh, they know that someone just turned in their notice, and in a month they will have a vacancy. And so they will keep us in mind and keep us in the loop. So those two partners are invaluable for the success of what we do.
And I would agree with Cynthia in terms of the hiring leaders and talent acquisition. And definitely as it relates to our Navigate program, our hiring managers play and leaders within the organization that oversee our internal team members. They play a huge role in supporting the growth and development of the individuals on their team, because that's time away from their role that they are spending to go through our Navigate program. So it's 5 months that the leader is committing to allowing their staff member to be away from whatever it is that their role currently is. So if they're in environmental services, if they are a transporter, if they are a CNA, you know, that's time off of the floor that they are supporting and committing, you know, their team member to participating. And so without that support, we wouldn't have team members that would be interested, and our leaders believe in the growth and development that comes from participating in our Navigate program. And then again, you know, as Cynthia said, from a talent acquisition perspective, we certainly need that support to know where are our areas of need. And so I work consistently to find out and where do we have the largest area of need, but also looking at our turnover and retention, so that we can also utilize the programs that we have to address retaining employees and decreasing our turnover. And so our Navigate program is one example of that. We know when we invest in our team members, they're more likely to stay with the organization because they do see opportunity. And then in addition to those two areas that Cynthia mentioned, I would say other leaders within HR that work in our operations, so at our health system, so on-site at our hospitals, they play an integral role in our Navigate program. And then in addition to that, just our executive leadership team and our board. They are very supportive of the initiatives that we have within workforce development to address our talent needs. And so without their support, you know, we wouldn't have the funding, we wouldn't have the support to go out and work with our workforce investment boards to apply for grants to get funding, and to have the staff we need to continue to develop programming and keep the programming that we have in place running smoothly.
That's awesome. It really does take a village to do this work. So I think the next question that's in the chat really is a little more Chytania and Shemia, but you know, so if you are at an organization, at a hospital in your community, and there's not a workforce board that you're working with, or you don't actually have one, what are a couple of those initial steps that you might take to really be intentional in trying to either make connections to the right groups or help develop a program? Chytania, why don't we start with you?
I would say look within the region to see what's out there, because there are some community agencies that may be playing in that space unbeknownst to you, because we also find when we get into some of these opportunities, you start to discover people like, well, have you heard of so-and-so? They got a grant to do X, Y, Z, or they're actually doing this particular work. Your tech colleges. Many, you know, whereas there may not be a workforce development board in a particular area, their tech colleges may actually have funding, or be a group that if they don't have funding, it's maybe an opportunity to have that conversation with them to see is there opportunity to create something similar to do this, but also being able to talk to the hospitals themselves, because they come to the table committed, because it takes a lot of intentionality within the organization, as you've heard described here, to do and pull off something like this. And there may be conversations, but you know, they may be looking for some additional partnerships in community to be able to pull something like this off. Even us as a workforce development board, we've brought our faith-based communities, our CBOs, to the table to be part of the efforts, especially when we talk about outreach and wanting to diversify the talent pipeline. And many of them do a great job of working within community and working with people. They may not have the resources to do it, but when we talk about wanting to help connect the people, they bring those resources to the table to really be able to tap into that. So while there may not be, and a state agencies also, being able to tap into your state agency who may be working directly with the hospital systems and put together a proposal or have some conversation with them, and they may actually come up with the funding to do, because there is commitment at the state level to want to see growth in particular healthcare. And so there's a commitment as well as intentional efforts happening at our state levels to help address some of the talent pipeline issues in healthcare.
And I agree with Chytania, absolutely. Starting with, finding out what is available in your area, definitely starting with the state. But what is key here, what has worked for us, how we got to this point, is relationships. That is what was extremely key within the workforce system. Chytania mentioned all of it already. I'm just adding to it. And the point is, when I say workforce system, that is, as she's mentioned, the educators, the employers, the community partners that are in the workforce development space. It is key to have leaders. And looks like Ron Painter is giving you some information directly. Thank you, Ron, to connect with. But I would say once you make that connection and you get the green, and first of all, you do want to find out, because there are a lot of collaboratives that are happening as well, potentially in your area. I know that's something that we have, but because of relationships, we stay connected and at the table, just to stay in the loop, stay and connected to what's going on in the community, and to figure out what is needed. So sometimes that is not just all of those leaders, but sometimes it's the community. I think their voices get lost a lot as well, as far as what is the need, what would they like to see in their communities. We're pursuing a grant right now, even with United Way, where it required us to be asked by certain communities, opportunity corridors communities, where there's a need. We didn't even know who these individuals are. We still don't. We'll find out, definitely if we're awarded. But there was an ask. But it's also because of, I'm sure, it's because of relationships that we have developed. So I would say that is key as well.
Wonderful. All right. Well, we're getting close to the top of the hour, so I'm going to ask everyone one last question. And this is the question I always ask because I think it's one that reveals just a great mix of input, which is really, if someone came to you and said, listen, we have a workforce problem, like what advice would you give me? Where should I start? What's the thing that you think is most important for me to do as I try to tackle this workforce challenge? So Michele, I'm giving you a heads up. I'm going to come to you first to start. But I am going to ask each of you, what is that one or two things that you would say if someone came to you and said, I really want to be able to grow the workforce in either my health system or my community? Where should I start? What should I do? What advice would you give them? And then I'll ask the rest of the group to chime in as well.
So that's a great question. So what I would say first and foremost is that if you're an employer, everybody wants to work with you. So workforce boards, community-based organizations, community college, universities, they are all trying to help individuals within the communities they serve find employment and find employment that is going to enable them a good quality of life. So if you're the employer and you have an issue with, solving a talent need or your workforce needs, all you have to do is raise your hand, and there is an enormity of organizations, more than likely, that want to work with you. All you have to do is just kind of reach out and say, how can you help me solve this problem? So great places to start, I think we've talked about. So as Chytania and Shemia have both said, workforce boards are a great place to start. Looking at what state agencies are available and community colleges as well, because oftentimes individuals, within the communities that employers serve, look at community colleges either to go back to school to get their GED, to increase their English language acquisition, or to pursue some type of post-secondary credential, and educational institutions are looking for employers to partner with them because they want their students to find employment. And so it's literally just a phone call, a handshake, or a raised hand away for somebody to be able to help you to address your talent needs. If you're not sure, you can always reach out to colleagues at other employers and ask them, hey, if you know someone in HR at an organization that's, across the street, what organizations do you work with? Or asking the community colleges, who do you partner with? Do you partner with the urban leagues? or different organizations to help build a pipeline for students to come in? What counselors or principals or superintendents do you work with at the school systems to funnel students to the community college, obviously to create that pipeline of future employees? So there's never a shortage of someone, even if you are in a small city or a small community or in a rural area, there's always an agency that is trying to help individuals find employment. And so again, all I can just say, it's literally phone call, handshake, or raised hand away from you finding the resources that you need to solve your workforce challenges.
Awesome. Shemia, I think you might have heard yourself nodding there, and that was huge agreement, but what's your advice?
Yeah, it really echoes everything, Michele. She hit the nail on the head. It really does. You know, working with a workforce development board from my lens and what I've experienced, it's been phenomenal because we've been so intentional about being as creative and innovative with partnerships so that someone, if they're coming to us to ask us, what can we do? It happens a lot. It happens with training providers. It happens with employers. It happens with initiatives like this, because we're open to thinking outside the box with an ultimate goal of collectively impacting this community, where we're connecting talent to business and business to talent. So I would definitely say the Workforce Development Board as much and as often as possible, but finding out, I mean, it really does mimic everything she said. The community colleges, universities, you know, educators, all of those workforce economic development, what is happening in that space, what's coming into the city that you need to tap into to create initiatives, listening to these best practices. You've heard us share about healthcare, but I'm sure they're happening in some other areas. I know that even we have done sector partnerships with different industries for construction, for healthcare. We've done at some point, and in doing those sector partnerships, what we've done is brought together educators, employers, community partners that are willing to train and talk about the shortages, talk about the demands, and then build something from that. So I think it takes all of those things. It does not take, as you heard me say, a national initiative that we did. It does not take that to make these things happen. It's just stepping outside the box and working with others that are willing to do the same to impact your community.
Wonderful. Thank you. Chytania, your advice.
They said a mouthful there, and I would just, add this piece is to be nimble, be open to change, because as much as you talk about, that's one of my kind of biggest gripes sometimes with employers is always talking about a worker shortage and not necessarily open to how do I change internally to be able to address the very thing that I'm complaining about that I need assistance with. We can think of all the great ideas in the world, but if you're not willing to change internally, be flexible internally in order to address some of those needs, then you end up with the same issue over and over and over again. So that's critical is don't bring people to the table if you really haven't addressed internally how, it's going to take some change inside for us to be able to make these things happen, because then you're going to end up in that same space. But also these forums, I think, I've been in this workforce development space almost 24 years now, and everything I've learned through coming to forums, being a part of national associations like NOB, where they bring people who's talking about what my issues and concerns are, and me being able to network and connect that way and call up a colleague or call up someone or shoot an email to say, hey, you talked about X, Y, Z. And then I can have more in-depth conversation of how can we, how did you do it? How did you address whether it be legal issues or partnership issues, or how did you connect with someone at your city or your state or et cetera? Because there's people out here, we all across the country have similar issues. Our employers have similar issues. We're all like striving for that same thing. Some people have come up with ways and they figured it out. So why reinvent the wheel when you can tap into somebody who's already been there, done that, got some ideas, lessons learned, to help you along the way. But, you know, my key nugget here is really you got to think outside the box in order to, you know, have a different outcome. You cannot just talk about it. You got to be about it, or else you just end up where you've been from the beginning.
Absolutely, and I know we're at the top of the hour. Cynthia, last word on your piece of advice?
Chytania kind of hit on it. For us, I believe it's identifying your critical roles. Do that work internally as an organization before you start going out and programming, because schools are going to be asking you, what do you need as far as the field of study? So knowing what those critical roles are, the skills needed to get there, also, you know, who are your education partners, and then the financial support to get people to get into that training so that they can get upskilled or get those credentials to fill those roles.
Well, I can't say thank you enough. I echo the comments in the chat. This was amazing. You all are doing amazing work. We will be sharing the recording with participants and posting it on our website, but encourage you to keep doing such amazing work, and we will continue to refer people to you for your great examples. So both to our participants and to our panelists, as well as our partners at NAWB, thank you so much, and have a good afternoon.
Thank you.
This concludes